si Dr. Necy Juat, tsaka si Dr. Rizza Marquez. Sila po ay mga taga NKTI.
Ayan.
Good
Good
morning.
morning. Good morning.
Kasi meron silang ang ating pag-uusapan ngayon ay cancer awareness.
Alright.
O, tapos sa kanilang, sa NKTI, meron silang of course oncology department kung saan doon talaga nakafocus sa cancer yung kanilang mga ginagawa. Dr. Necy, ano po ang, walk us through po the oncology department.
Okay. For NKTI, we have oncology section. Although we also have a training program at the National Kidney and Transplant Institute. Hindi dahil it's National Kidney and Transplant Institute, mostly kidney, but we cater all the solid organ tumors. So right now we have may bago kaming building. It was 3 years ago. We call it Diagnostic Center. This Diagnostic Center has the chemotherapy unit. We have the CT scan, the MRI. And this June or July, this coming July, we will be opening our radiation center. And the PET scan, it is the first PET scan. This is the first in the government hospital that will have a PET scan. Yes. Remember, only St. Luke's has a PET scan. But right now, we're opening a PET scan. And we also have our own cyclotron, wherein yung nuclear material, we process it. And then we can give it to other hospitals that would want to have a PET scan.
Okay.
Sige po, Doktora, bigyan niyo lang po kami ng overview about yung mga cancer incident po dito sa ating bansa. In your experience, in your statistics po sa inyong department, alam po natin na talamak po yung breast cancer,
Yes.
di ba yung mga lung cancer. Go ahead po.
For male, of course, the most common is still prostate cancer. Second is lung cancer. For female, it's breast. And the second is lung cancer. It's because mas marami ng babae ang nagsisigarilyo. So tumataas talaga yung incidence of lung cancer right now.
So dapat talaga may awareness dun sa bawal sa paninigarilyo.
Yes.
Kasi imagine number 2 siya for both male and female. So basically, napakalaking pera at problema ang ibibigay nito pag hindi natin naiwasan.
Kaya tama rin yung sa mga there's a law na yung sa cigarette, di ba?
Dangerous to your health.
Yes, para matakot
Picture
yung mga
ad.
niniligarilyo, lalo
Kaya
na
lang
sa bata.
Kaya lang napakaliit na portion ng yung part na yun. Dapat mas malaki-laki pa.
Yes.
Dun po sa may mga doc, no, for the both of you, kasi dun sa mga tao po na meron din sila mga magulang na namatay po sa cancer, katulad po nung kay Diego, both of his parents died of cancer. You also advise them to check themselves regularly, have themselves checked regularly, kasi ito po ay, if I'm not mistaken, namamana po talaga with a certain percentage. Tama po ba?
Yes, that's good. We have the radiologist, at least we can have the screening.
Yeah, for the breast, the mandate is at 40 years old. Regardless if you have a family history, kung may nanay ka, mother ka na, or tita ka, that's regardless. Basta 40 years old,
Have
magsa-start ka
yourself
na ng mammography annually.
That's annually.
Now, if you have a mother na may breast cancer, kung medyo maaga siya na breast cancer, 10 years before, siya yung age niya, 10 years before, mag-start ka na.
Pa-check. And this is annually.
Annual na mammogram.
Academic question ako. Kasi diba dapat bukod dun sa mammography, kailangan nagsi-self-examination din tayo.
Yes,
Kailan po
certainly.
tayo dapat ideally nagsisimula ng self-examination sa ating breast area for a women?
Every morning.
Usually,
At
you
what
start
age
it at
ka
the
dapat
age of
mag-start?
20 years
At the age
old.
of 20, dapat nagsistart
And then you do it every time you have your bath. So mas madali. And your mammography should be done also. It should be 1 week after
Menstruation.
menses.
Kasi yun yung
You have
hindi
to be
masyado
sure that
masakit. Oo, kasi pagka during menstruation and a week before menstruation, medyo tender yung breast.
Maga eh.
So, 1 week after, yun
Parang
yung
normal
recommended.
na.
Oo, para hindi na masyado tender yung breast.
But if I may ask po, yung kay Diego po, kasi siya po, lalaki po siya, no? I mean, since both parents died of cancer nga po, ano yung pwede niyang ipapascreen to avoid possibility of having cancer later on?
Her mother died of
Breast cancer.
breast, and the father is
Lung
Lung
cancer.
cancer.
If he's a smoker,
It's not, no?
It's not anymore.
Binugtungan anymore.
even if you are not, if you are an ex-smoker, you high risk ka pa rin to have lung cancer.
Yes.
So better to do a chest X-ray every year just to check. It depends kung ilang taon na siya. Colonoscopy if pwede rin. It depends on the age. Check also for prostate. So yun yung mga ano. Of course, you have to have a healthy living and exercise. Importante yun.
Okay. So, balikan po natin yung oncology unit nyo po sa NKTI. Ano po ang pagkakaiba po nito or mas advantage po ng oncology unit ng NKTI compared po sa other hospitals?
Number one, maganda yung building, the joke lang.
Government hospital.
So, when you go there, parang wow, dito government hospital. First, we have a training program for oncology. So, when you have a training program, you have, like us, we have 6 fellows. So, if I'm a consultant and I have fellows, I'm very confident that all my patients will be taken care of. So, talagang alagang-alaga. Second, we have the best diagnostic and we have the best laboratories. Some hospitals send, like, we have immunostaining. Yun yung, if you would like to know kung ano ba talaga tong cancer na to, saan ba talaga galing. So, maganda yung laboratory namin.
Meron din po kayong charity.
Yes,
sa
we have
loob ng
charity. We have charity patient for oncology. We also have clinical trials ongoing sa NKI. This clinical trial is, if you are included in this trial, free yung medicine mo, free ang diagnostic, even yung pamasahe ng pasyente like 1,000 pesos is covered.
As of the moment, what clinical trials do you have? Like, for what type of cancers?
Right now, we have, for breast, we have 2 clinical trials. We had 4 patients who have neoadjuvant, wherein mga stage 1 to 3, na kailangan ng chemotherapy muna bago surgery.
This is for the breast.
For patients who are HER2 positive,
Okay, here too.
there's this test na kailangan mag-positive ka to be included in this one. Second, we have for stage 4 breast CA. So, HER2 positive din yon. So, pwede yon. Libre lahat yon. Kasi the cost of treatment would cost you
Mahal.
1.8 to 2 million a year. We also have for lung cancer. Lung cancer for mga 3rd line or 1st line na stage 4. We also have darating din for liver cancer naman. It's a gene therapy treatment.
But yung magiging free po sila dun sa treatment if they'll be included in the clinical
Yes.
trial. Ano pong span nun? I mean, during the entire course po?
Yes.
Of the-
hanggang mag-progress sila. Basta nag-respond sila, kasama sila dun sa
So
trial.
far, how many subjects would you be needing for your clinical
It's
trial?
a competitive trial, so hindi lang naman NKI, other hospital has it. So, for example, for breast, we need at least 5 patients.
Ayan. Para po sa mga iba pang detalye tungkol po sa oncology unit po ng NKTI, Dr. Rizza and Dr. Necy, kindly tell us or tell the viewers po about the contact details.
Okay. So, if you want na dun sa mga program namin sa NKI, you can call 981-0300. And then you can ask the operator to connect you to the chemotherapy unit.
And
Tara.
for the diagnostic, so we have X-ray, general X-ray, and special procedures. We also have ultrasound and special procedures like Doppler and ultrasound-guided biopsies. We also have CT scan. We have a 256 CT scan. And we also have an MRI. It's 3 Tesla MRI. And we also have, this July, we'll be opening the PET CT and the linear axillary. So that's, if you have questions, you can call our trunk line, 9810300. And then you can connect with the radiology section.
Especially for scheduling, kasi hindi naman po pwedeng
Yes.
sabay-sabay pupunta.
Yes.
Yan. Maraming salamat po sa inyo, Dr. Necy Juat, medical oncologist, and of course, Dr. Rizza Marquez, radiologist, both from NKTI.
Thank you.
Thank you.